Welcome to Module 3. This module is divided into two parts. At the first part, you will be introduced to the different classification of joints based on their uniting medium as well as on their degree of movement. In addition, basic parts of true joints will be tackled, including accessory parts like ligaments. The second part will discuss the different joints in the body. Thus, a better understanding of the skeletal system is a must to appreciate the presentation. At the end of this module, you should be able to classify the joints based on their uniting medium and name the different joints in the body. Arthrology or syndesmology is the study of joints. Joints are the area where the two bones meet. It is important to facilitate the movement of certain bones, thus the entire animal body. Joints may be classified based on a variety of schemes, usually by that of the anatomy or degree of movement. It may be classified as simple joint if it has articulations between two articulating bones, or compound joint if more than two articulating bones. Joints can also be classified depending on the predominant uniting medium present. Fibrous joint is united by fibrous tissue. It has no joint cavity, little or no movement, and often temporary and ossify. Cartilaginous joint is united by cartilage, usually by a hyaline or a fibrocartilage. It has no joint cavity with little or no movement. And lastly, synovial joint is united by a joint capsule. It has a joint cavity and freely movable. We will discuss each type of joint one by one with examples on the next slides. As previously mentioned, fibrous joints are united by fibrous tissue and have no joint cavity. They can be further subdivided into three. Syndesmosis is a ligamentous joint united by a fibrous tissue that permits only slight movement. They are present on costal cartilage in costal arc or at the interosseous ligament between the radius and the ulna. Next is we have the suture. This is a fibrous joint between bones of the skull. They often ossify in maturity. And last, gomphosis. This is a specialized articulation in the teeth with the mandible and maxilla. The collagenous tissues and fibroblasts that join the tooth to the socket constitute the periodontium. Next is the cartilaginous joint. This type of joint is united by cartilage and with no intervening joint cavity. Part of this joint is the synchondrosis. This is an immovable joint in which the uniting medium is a hyaline cartilage. The union of the diaphysis and epiphysis of an immature bone or its physis or growth plate is an example of synchondrosis. Symphysis, on one hand, is a fibrocartilaginous joint. It is united by a flattened disc of fibrocartilage as found between the adjacent pelvic bones at the pelvic symphysis or at the mandible via the mandibular symphysis and between the bodies of adjacent vertebrae and sternebrae. You might also encounter the term synostosis. This is when the fibrous or cartilaginous tissue separating adjacent bones in syndesmosis, synchondrosis, and symphysis was replaced by a bone as a result of their aging or degenerative process. Finally, we have the synovial joint. This is also known as the diarthrodial or the true joint. The uniting medium is a joint capsule, which consists of two layers. The synovial membrane is a deeper layer that secretes the synovial fluid or the synovia. This lubricates the normal joint. On the other hand, the fibrous capsule is the superficial layer. It may be thickened in certain areas to form the extracapsular or the periarticular ligaments that connect adjacent bones and help stabilize the joint. Aside from the joint capsule, a synovial joint has the following general parts. It has articular surfaces, which are specialized layers of the compact bone on the surfaces that articulate with other bones. Each articular surface is being covered by a hyaline cartilage called articular cartilage. The articular cavity or the synovial cavity is the space between the adjacent bones of the joint surrounded by the joint capsule. A joint may also be accompanied by supporting structures like ligaments and tendons. For point of comparison, ligaments are connective tissue bands that extend from bone to bone, while tendons are connective tissue bands that connect muscle to bone. Ligaments can be classified as intra or extracapsular ligaments. To visualize the ligaments, here is an example of the ligaments present at the stifle or the knee joint. Intracapsular or intra-articular ligaments are found within joints and are surrounded by the synovial membrane. Example of these ligaments is the cranial and caudal cruciate ligaments of the stifle. On one hand, extracapsular or the periarticular ligaments are located external to the joint capsule. They include the collateral, dorsal, palmar, plantar, and annular ligament. Collateral ligaments lie on the medial and lateral aspects of a joint, as you can see here, while the dorsal and palmar or plantar ligaments lie in front and behind of the joint. Annular ligaments surround the joint, and their fibers generally encircle the joint to strengthen and protect the capsule. Patellar ligament is also present here, is an example of an extracapsular ligament. Menisci or fibrocartilage discs are intersposed between surfaces of some joints, where they contribute to the congruency of the articular cartilages and probably play a role in a complex joint movements. Menisci are truly intracapsular in that they are not covered by the synovial membrane. Prominent menisci are found at the stifle and at the temporomandibular joint. Synovial joints are movable, thus it features different types of movement. Here, we can discuss the different movements that a synovial joint can perform. Flexion is decreasing the angle between bones. Extension is increasing the angle between bones. Adduction is moving part towards the median plane. In contrast, abduction is moving part away from the median plane. Other movements include circumduction, which is movement circumscribing a cone, combining flexion, abduction, extension, and adduction in order. Rotation, on the other hand, is the movement around the long axis of a part, while a universal movement is all of the above movement. The synovial joints in an animal body can also be classified based on the type of movement it can perform. Ganglimus or hinge joint can move only in their sagittal plane. It is limited only to flexion, extension, and hyperextension. It is uniaxial, allowing movements at right angles. Examples include the fetlock and the elbow. Here is an example of a fetlock joint. Plane have only slight gliding movements between relatively flat opposed surfaces as shown here. These surfaces are called facets. They are multi-axial. Example includes the joints between the carpal and the cranial and caudal articulations between the vertebrae. Trochoid or pivot joint is uniaxial. It is one in which rotary movement occurs around one axis. Typical example is the atlantoaxial joint. Remember the dens or the pointed odontoid process of the axis that articulates with the caudal part of the atlas to form the atlantoaxial joint. Spheroid or the ball and socket permits movement in any direction. It consists of a spheroidal head fitting in a socket allowing universal movement, like in the case of the shoulder and the hip joint. In condylar joint, a convex articular condyles articulates with a concave articular surface. It can perform flexion, extension, and little rotation. Examples include the temporomandibular joint and the femorotibial joint. Ellipsoid joint or the ganglimus is a biaxial joint formed by ellipsoidal convex surface fitting into concavity of another bone. It can perform flexion, extension, abduction, adduction, and small rotation. The atlanto-occipital joint forms an example of an ellipsoid joint. And this ends our presentation on part 1 of Module 3. You are now familiar with the different types of joints, the basic parts as well as the type of a synovial joint. You may now proceed to part 2, which will discuss the location of specific joints in the body.